This show was produced by and first broadcast on Radio Kidnappers, Hawke's Bay's community access radio station. Thanks to New Zealand On Air for enabling us to put Hawke's Bay voices on air.
Good morning, everyone. This is Heiko from Acupuncture on Air, where every Tuesday on Radio Kidnappers at around 11 o'clock, we have a special show on acupuncture around New Zealand, and in particular we interview acupuncturists from all around the country. Today we've got Kane Monrad again, who's been doing a series of shows with us, in particular in specialising in women's problems. And today we've got a very interesting subject on endometriosis, which I know, and people out there have probably heard about this. It's quite common, so we're going to get some feedback from Kane. Good morning, Kane. How are you?
Hey, Heiko. How you doing? Great to be back. And this is a bit of an extensive topic here on endometriosis.
Yeah, no, it's a big one, and in some aspects controversial. So, but first, let's just in 3 words or less, what is endometriosis from a Western medicine point of view?
Yeah, well, in a nutshell, it is a tissue that normally is on the inside of the uterus, but for whatever reason it starts to grow on the outside of the uterus, and then that can cause pain, especially in the ovaries or the fallopian tubes, and in fact the endometrial tissue can even grow in other areas like the bowels and say the small intestine as well.
Yeah, because I know that I have had some patients where for many years they went sort of misdiagnosed, or they couldn't work out what it was, and in the end, only through examinations did they find that there was some endometrial tissue actually in the bowels. So it's probably more common than what we think. Now, this pain for endometriosis, which is, I know that not all women get pain with endometriosis, but of course the majority do. When do they get the pain?
Well, the pain with endo, it can be irregular times, and it can be different for different women, right? Hence is why some women do go undiagnosed, and it can be before or after the menstrual cycle, after intercourse maybe, and during bowel movements or even urination. So yeah, some women get these severe pains, others don't even get any of the pain.
Yeah, so that would, I guess, make it quite a challenge in getting the diagnosis, because, if they're getting pain during urination, then there can be 100 other reasons why they be getting that. But listen, can you tell us, or do they know, what causes endometriosis from a medical Western science point of view?
Yeah, they know why it causes the pain, because the endometrial sticks to the organs, okay? So through Western medicine knows that there is hormonal component a part of that, but there's no explanation as to why some women will have the imbalanced hormone levels and no endometriosis, and others get it. And hormone treatment is not actually that effective, and these type of patients usually end up in our sort of clinics because they're always looking for something different as well. They're always looking for something outside of the box. But actually,
because I know even with
effect on that.
Say with menopause. I mean, some women they'll have the test, the estrogen levels will be low because they're at that age, but no signs and symptoms. But then others, same sort of levels and lots of menopause symptoms. So I guess I can understand why the endometriosis can be such a confusing. Now, but from a traditional Chinese medicine diagnosis, is there a specific cause, or is there a reason, or how do we tackle it?
Well, this concept is still difficult to explain, and when comparing traditional Chinese medicine to Western medicine, there is no one specific cause in Chinese medicine. The Western medicine diagnosis might be the same, but people are all different, right? So they could have endo with, say, from a Chinese medicine point of view, with spleen qi deficiency. They could have endo with liver qi stagnation. They could have endo with having a problem with what we would call the extra vessels, which is the chong or the penetrating meridian. So slightly different to Western medicine, where we look at the whole body as a picture, and there could be, for for some people can have this imbalance, some people can have that imbalance.
So are you looking at the patients and all the other signs and symptoms as well?
Yeah, exactly that, and that's how we sort of come up with how we could come up with a diagnosis. So you could have endo and have headaches before the cycle, or diarrhea before the cycle, pale blood, lots of fresh blood, clots, no clots, good appetite, bad appetite. So these are other signs and symptoms that could be endless. There's so many. We have to draw the picture for that individual person that comes in. So one person that may have endo might be a totally different diagnosis than another person that has endo in the same day in the clinic.
Yep. Yeah, and then what we do is, I know it's been, we formulate a traditional Chinese medicine diagnosis, and as you said, for example, it might be stuck liver energy, with deficiency of the spleen or whatever, and so that's quite interesting. Anything else you can tell us about that?
Yeah, I mean the bonus being, of course, for the patient is that they start feeling better and their symptoms start changing. From a Chinese medicine point of view, we look at acupuncture, herbal medicine, those sort of things. So one of those things is that what I do like is it really, really can help the pain, the irregular bowel movements, the energy. So once you start trying to balance the whole body as a whole, then what happens is they start to notice all these other things start to right itself as well, which means that they're improving, right?
Yeah. Now, I guess the million-dollar question is, and I know when Ken has interviewed me in the past, his question is always very, very scientific. How long does it take? How many treatments? There you go, Kane. Give us the answer.
Oh, it's good and fair inquiry, I guess. Hey, look, I understand that women are going through and then need a goal and a time frame, but everyone is different, of course, and some have had it for 10 years, some have had, and with 100 complaints with it as well. So, if they're eating bad diet, pizza and Coke and all that sort of thing, and start changing a few things, as a general rule, it's not going to be a quick fix. It's a chronic condition, but we can get some great results if they start changing lifestyle, start changing some of the things that they've been doing. So, yeah, I mean, no hard and fast rules there, Heiko.
Yeah, but my experience is I'm finding, I'm suggesting at least 3 menstrual cycles to treat them for that. And I like to get in there, I guess the words aggressively or confidently is acupuncture twice a week plus the herbs. Now, What about you, Kane? Have you got any...
Yeah, absolutely. I mean, some of these women, they come in with severe pain. Some women even get this daily, not just around their cycle time, but some women even get it daily. So hard and fast is quite good for these clients. So what I would do is I would give them treatment, and then I'd sort of emphasize on a lot of treatment, like moxibustion to do at home. We've talked about moxa on these shows before, but it's that, to get that internal heat in there, especially if they're a little bit deficient or cold, we warm that body up, and they can easily do this stuff at home that really helps. At the end, it's very difficult, but treatable, and the results can be obtained without drug or hormone therapy.
Yeah, and ideally, I'd love to see the mums, starting to bring in their teenage daughters in the very early stages. Because, as I said, they get diagnosed with it. They're only 14 or 15 years of old, and then they start a sort of a mirage of antibiotics, contraceptive pills, and all these sorts of things, and and then of course, and then you get more problems as associated with that.
Absolutely, yeah. And what I am actually finding, Heiko, is that they're getting younger and younger, and there seems to be more and more of this out there at the moment.
Yeah. So, Well, anyway, let's just note that there's good news that we can treat it. But so we're going to have to finish up with the show. So thanks again for coming on, and I'll also put your Hamilton Clinic details up on the comment section in the YouTube. But just before you go, just tell us your phone number, your best phone number, if people want to contact you.
Yeah, best phone number is 027 4999 831, and that's Kane at Connect Therapies.
Right. And just to close the show, and pardon the pun, but we're going to have a song called Let It Bleed by the Rolling Stones. And I look forward to seeing everybody and you, Kane, again on the next show.
No problems. Take care.
Okay, here we go. Bye.
Thank you. Bye.
This show was produced by and first broadcast on Radio Kidnappers, Hawke's Bay's community access radio station. Thanks to New Zealand On Air for enabling us to put Hawke's Bay voices on air.